Thank you all. I wish you a warm welcome to PCR Planet on April 20. I will take you around the world to meet our friends and peers, and today we are going to visit Dr. Habib Gamra in Tunisia and Dr. Haitham Amin in Bahrain. Welcome to both of you.
Thank you.
Let me start with Haitham. Tell us a little bit about yourself and the situation of the epidemic in the country.
Yes, William. We had our first case 8 weeks ago, and so far we are in partial lockdown. We have close to 2,000 cases with 1,100 active ones, with very low mortality, less than 0.5%. We have a very active testing, tracing, and treatment. And this has been headed by a national task force that has been instituted for the past 2 months, headed by the Crown Prince. So things are under control, but we're getting prepared for any potential surge in cases.
That's good to hear. Thank you. And what about yourself, Habib? Tell us about Tunisia, your own country, but of course with your engagement in Pascar and the entire region. Say a few words also, if you can, about the rest of Africa, particularly Northern Africa.
Yeah, thank you, William. I know the epidemic hit Tunisia and North Africa a little bit later than Europe. And this actually has given some time to the authorities to take some preemptive measures, particularly with regard to confinement and locking down the country. Tunisia has been locked down on March 16 with a curfew at night. So during the day, you would see maybe a few people going to stores, but at night there is nobody who is allowed actually to leave home unless for very emergent services like going to the hospital. And with these measures, things looks like they're under control. We have less than 900 cases up to now with only 38 deaths. So that's approximately 3 to 4% mortality. It's a little bit similar in North Africa. Now in the rest of Africa, particularly sub-Saharan Africa, the epidemic is in early stage. WHO is predicting very high mortality rate, and hopefully those predictions will be wrong. But we'll see in the coming days.
Oh, that's good to hear. So the curfew is actually a very strong decision. So this was, I mean, you can enforce this in the country without too much difficulty?
You know, it has been decided because during the day, people, they were not respecting those, the confinement 100%. So the government has decided to take stronger measures, particularly at night. And it looks like it's working, particularly at night.
And your country is closed at the moment. If I wanted to visit you, no way.
No, there is no way. The country is completely locked down. The few travelers that have been blocked somewhere and coming to the country, they cannot go home when they enter the country. They have to go and for 2 weeks, at least 2 weeks quarantine. And then they would be sent to centers or hotels for that period of time.
Thank you. And what about Bahrain, Haitham? You mentioned about, you know, the task force and the decisions that were taken by the government, and you're also well prepared, I think, for what might or hopefully might not happen.
We have similar issues of, you know, wide-scale testing. We have the issue of the quarantine for all repatriated nationals. We cannot. The airport is closed, so only Bahraini nationals can be repatriated. And the task force headed by the Crown Prince wanted to establish 500 ICU beds to cover any potential surge in sick patients. So, as an example, in my hospital, we have a car park, which is a standalone building close to our hospital. It's a multi-story car park. This was converted into a 130-bed, fully functional ICU over a 10-day period. It is ready. and thankfully we haven't had to use it so far, but it is out of the 500 beds, ICU beds that the country will have on standby should critical cases surge. But so far we only have a handful, and everything's under control.
Did I understand you well? You're saying that a car park was transformed into a massive ICU in 10 days?
Yes, we wanted to have a building that was close to our hospital. We had a multi-story car park. We took a large floor and converted it, to ICU and step down. It is fully equipped with beds, ventilators, dialysis machines, and the potential for ECMO machines to be used in that setting. And it is running and functional. So we're getting prepared just in case we have a surge in critically sick patients. Yes, we use that building, and it's something to see. It's very impressive. Very impressive.
Amazing. That's amazing. Habib, what is the impact on your own practice? I suppose that, like in many other areas, there is no elective procedures any longer. And how do you see this evolving over the coming weeks?
We have stopped doing any elective cases for the last month or so since the confinement decision by the government. That's March 16. Now, surprisingly, during the 3 to 4 weeks after the confinement, we have seen a dramatic decrease of the number of patients presenting with STEMI or acute coronary syndrome in general. And, there are many explanations to that. I think this has been happening everywhere.
Yes.
We only had very few cases, and it was very, very surprising. Now, for the last week or maybe 10 days, we are observing now a return to normal of the activity, receiving 2 to 3 cases of STEMI. Now, what we have done since this epidemic arrived to the country, and we have changed a little bit our practice, so we are recommending lytic therapy for every patient coming outside of our hospital. And then this will give us time actually to triage the patient, whether it's COVID plus or COVID negative. Now, for the rest of the patients that present to our hospital, they are taken directly to the cath lab, but they have to go through a triage at the emergency department in order to see if there is a high probability of being COVID plus or COVID negative.
Thank you. Yeah, we hear this over and over again. Patients are told to stay home. So they do so, and even with crushing chest pain, they're, reluctant to call the ambulance and stay home for longer, and that's why you have those late presentations and the reduction in the numbers of patients admitted with acute coronary syndromes. I'm turning to Haitham again. I think what is unique in your country compared to many others is that you have a very high rate of testing across the population and not just in hospitals. Do you have any data or information about that already?
We're a population of 1.5 million. We've done more than 85,000 tests to date, and the task force goals were to test, track patients who are positive and treat them, to basically try to curb the surge in cases. So all our patients that we admit to hospital for admission get a swab test for COVID. We have mobile units that go out to the community to actually test communities. And we have drive-through services where somebody can, in his car, basically drive through. You just need to book in advance the test date and time, and you can get tested. And we're also doing random testing where the general population would get a call to come and be randomly tested. So I think this is the way the plan is to try to test as much as possible, track the patients and their contacts, and treat them to basically try and curb the spread of disease.
And when you're saying treat them, you have some specific protocols, or which drugs are you actually proposing at this early stage when a person is diagnosed with or without symptoms?
So all asymptomatic patients get isolated. If they're symptomatic, they would be started on the hydroxychloroquine, azithromycin. There is a protocol that the task force is using, including other antiviral therapies. And recently, the issue of convalescent plasma has come into the fray and is being also used. So our infectious disease and task force are relating with experts in the field outside and using the most current recommendations coming from international societies.
Well, that's interesting, and hopefully, we'll learn from your experience. I'd like to thank you for, we're delighted to have news from you, yourself, and your colleagues and your countries. And before closing this conversation, I would like to ask each of you if you have, a specific message or some personal experience that you would like to share with the community. And maybe I'll start with Habib, and then we'll turn to Haitham.
Thank you, William. I think, again, in Africa, we are receiving messages from WHO that we're going to have a disaster, and we are hoping that will not happen. One of the rare options that we have in our continent is just to lock ourselves down. That's the message that we need to send everywhere in order to reduce that risk. The second thing I think we have learned in Africa from the experience of Europe and through PCR Planet and other initiatives, I hope we can learn from each other. And together, I'm sure with no doubt that we will defeat this terrible epidemic.
Thank you. Haitham?
Well, I think one of the biggest things I've learned over the past couple of months has been we always put the patient first. All our lives, this is what we do, what we're trained ethically and morally to do. But I think the change of the past couple of weeks has been we have to think of ourselves, our colleagues, and the potential for spreading, this still unknown virus to our colleagues and to our loved ones once we go back home. So being careful, looking after not just our patients but ourselves and the health of our nurses, technicians, all the staff in the lab, I think is essential, and we have to be cognizant of this potential danger and just be careful.
Thank you for these strong message. And again, it was a pleasure to hear from you, and let's stay in touch. Thank you very much for sharing your experience with the community.
Thank you.
Thank you. Yeah.